Hi, my name is Dr. Gjergo, and I'm here at Advanced Foot and Ankle Centers of Illinois. All right, guys, so I'm here to talk to you about neuromas. So, what are neuromas? So, in between your toes, you have small little nerves that run through all the way to the end of your toe. And neuromas happen when the tissue around that nerve gets thickened. So, the nerve gets swollen and irritated. So, usually, what symptoms people notice with neuromas are numbness, tingling, sharp shooting pain in between the toes and all the way to the tops of the toes. And usually there's a feeling that you're walking on something, whether it's you're walking on like a little pebble or just some discomfort in that area. So like we mentioned, the nerves that run in between your toes here, they get swollen, irritated, and you're going to have pain at both of the toes where the nerve runs through. And so you might feel like you're walking like a little pebble on the balls of your feet. And that's really typical with neuromas because that inflamed nerve is right there pressing at the center. So you're getting pain to both of the toes, but also feel like there's something kind of stuck in there. So things that can cause neuromas or worsen the symptoms of neuromas are tight shoes that kind of constrict the toes and impinge on that nerve a little bit, so it makes it more painful for you. A lot of activities, so stress to the foot, doing a lot of activities, sports, injuries can make it worse as well. So there's different treatment options when it comes to neuromas depending on the severity of your pain. So when you're in the office, we'll examine your foot, take a look and see if one, we hear a click when we examine it, two, if there's pain in a specific area, and kind of talk about the symptoms that you're experiencing. And then on top of the physical exam that we'll do in the office, we'll also take into consideration some imaging. So we'll take x-rays and we'll take a look at how the bones look as well. Sometimes we'll notice kind of like a V sign of the toes. So the toes will be split apart because that inflamed nerve is causing that. We'll go through the x-rays with you and then talk about the different treatment options. And then after that, we can do one of multiple things. We can kind of start with some conservative therapy, which includes resting it, icing it, taking some ibuprofen to alleviate the pain. If the pain is pretty severe and you're noticing a limitation on daily activities, we can try a steroid injection. That'll calm down the inflammation really quick, and a lot of people gain a lot of relief from that. And then when it comes to neuromas too, definitely get a supportive shoe that is wide so you can alleviate some of that pain. And we'll talk about inserts. Inserts help a lot of people with neuromas. We can do different modifications on the inserts to help with the neuroma. On top of that, there's different therapy modalities. We have a bunch of them in this office, and one of them will definitely help your neuroma pain. And so on your treatment journey for neuromas, we'll discuss if conservative therapy or other modalities aren't helping with the pain, there is always a surgical approach. It's always a last step approach, and we talk about the patient, about their pain and symptoms. The surgery includes going in there and removing that nerve that's affected and inflamed. We can talk about this after discussing other treatment modalities with you. So if you're having any of the symptoms we talked about or any pain in between your toes, give us a call here at Advanced Foot and Ankle Centers in Illinois.